Welcome everybody, and I am so glad to be able to talk to you about HealthLinks. I've been working in HealthLinks since last summer, and it's an honor to be able to introduce you to the work that we've done so far and through the province. And I hope you've had a chance to read the, or actually to watch the video that the Ministry of Health and Long-Term Care have done on HealthLinks. And so please, if you haven't already had a chance to watch that, please go back and find that link, which should be right with this video for you to be able to watch. So I'm just going to start to talk to you about, from my perspective, what is a HealthLink. It truly just is about healthcare providers getting together with patients and families to be able to support them better to live independently in the community. And in order for that to happen, it's really about centering, coordinating care around the patient. It is a strategy that the Ministry of Health and Long-Term Care have rolled out over the last couple of years, and as you know, we're well into rolling it out in Huron, Perth, and just starting in London, Middlesex. So then why would anybody think about implementing a HealthLink? And I think the research started a couple of decades ago, really finding out that as older people went into hospital, that they suffered some functional decline. And if you think about, normally when you're in hospital, you're in bed a lot, and your muscles don't work as to the same extent that they might when you're up and walking. And so the research did say that people experience functional decline when in hospital. So it means that when you need, as an individual, to use the emergency department and or the hospital to get your health care, it may not be meeting your needs in the best way. And so HealthLinks is really about providing that care in the right place at the right time, and hopefully for the most of that being in the community. So then the province also did some thinking about what the benefits of a HealthLink might be, and cost is one of those. And so when you look at healthcare costs across the province, 66% actually, 2/3 of healthcare costs are actually consumed by 5% of the population. And you can see in this particular graph or pie graph that there's quite a bit of the population that do account for that 2/3 of the healthcare costs. And so what and why would we implement that kind of HealthLink? If you think about someone in your family or someone who's been ill recently, you know that there are lots of appointments. You end up having, it may end up going to the family physician, you may end up going to a specialist. In this particular picture, it's a respirologist. You may need some support around some mental health issues, which would be a different appointment. You may be going to an adult day program. You may have a personal support worker that comes into the home, and you have a care coordinator that may help you. All of those different people you may see at different points in time over a few days or weeks. And what HealthLinks does is give you an opportunity to see all of those people in one place at one time. And so you see in this particular picture the chain that goes around all of those different care providers that you may be interacting with. And we know as people get more and more vulnerable, it's more and more difficult for them to get to all of those different appointments. And so this is the really key thing about HealthLinks, is bringing all of those providers together to actually work with you as the patient and your family to coordinate that care. In our particular LHIN, we've done some different statistics in all of the different geographies, and I just highlight Huron Perth here because I know most of you today are from Huron Perth. I think some of you are from London, Middlesex as well, but these numbers are from Huron Perth. And so just to give you a sense of the amount of time that people are relying on hospitals and emergency departments for their care, in Huron Perth, so this would be April the 1st in 2013-14 through to March the 31st of 2014. These patients, 354 of them, actually visited the emergency department almost 2,800 times were admitted to the inpatients, almost 1,600 times, and saw needed some rehabilitation and mental health as well. And a lot of those, 81%, were receiving some type of service in the home as well. And so you know that these are very vulnerable people. If you think back to that picture, having lots of different appointments to see lots of different people, and so are in great need of having their care coordinated for them. The London Middlesex numbers are here on the next slide, and so given the larger population in London Middlesex, it's not a surprise that there's more patients in that area. So you see that there's 880, again with a large number of emergency department visits and acute inpatients. And you'll see that they also have experienced inpatient rehab discharges as well as inpatient mental health discharges. And so just, I think the key to both of these slides is that we do have a fair amount of patients that already we can identify that do need the services of a coordinated care plan. So HealthLinks isn't necessarily new in healthcare. It's been called different things in different places. And so as an example of that, in Quebec, in a rural area like southwestern Ontario, Quebec noted that there was a high usage in a small number of patients of the healthcare system. And so they put in a very specific intervention around coordinating care. And they followed their first 200 people over 2 years, and all of those people said that they reported an improved sense of well-being at the end of that 2 years. And you see here on this slide that they did use the emergency department quite a bit less, as well as being admitted to the hospital 83% fewer. So we're building on some of that work in Quebec that had such great outcomes. The next slide has a long list of partners, and really these are all of the different kinds of organizations and providers, along with the patient and their families, that could be part of a HealthLink depending on the needs of the particular patient. And you see that's a long list. Where are we at right now with HealthLinks in the South West LHIN? Today we're concentrating mostly on Huron Perth and London Middlesex. And so Huron Perth has been in the implementation phase for almost 2 years and have actually completed a number of coordinated care plans for very vulnerable patients. London Middlesex had their business plan approved in late fall, early winter, and they are just getting their processes in place to begin their coordinated care planning. Grey Bruce, both the HealthLink in North and the HealthLink in South, are beginning to do some planning. Their business plans have been submitted to the ministry. And the other two, Oxford and Elgin, are really still in the readiness assessment stage and will be hoping to move to business plans soon. The next slide just shows from a healthcare journey point of view some of the ways that HealthLinks interacts. And so if you start in the upper right-hand corner of that slide, it's really identifying, first of all, who these people are who are requiring the emergency department and inpatient hospital admissions to manage their health. Once you have that person or those people identified, you really need to then begin to work with the individuals to coordinate their care plans, sharing the information, and you can think about all of those different rooms or different appointments and the need to share the information across the providers so that that coordinated care plan actually works. And then you need to think about the existing resources to implement the coordinated care plan. And so HealthLinks wasn't set up to put a whole bunch of new resources into place. It was rather to make the existing resources work better. And then once you've done that, there may be barriers and gaps in your particular area of the LHIN that we may want to address. But we need to leverage the existing ones first. So then how will the learning collaborative that you're going to partake in support the goals of the HealthLinks? Well, it's really to bring together those of you who work with vulnerable patients, identify yourself as teams, give you a chance to learn about each other, learn about the best practices, understand the roles that you're that you're each playing in the care of these vulnerable patients. And so you see also on this slide that there's lots of topics that those of you who are attending the Learning Collaborative will have an opportunity to learn about. This first learning day, you'll spend a lot of time understanding the coordinated care planning process, the tools that you can use and how to do that, as well as learning some best practices around chronic obstructive pulmonary disease. The other pieces that you'll understand as you go through the Learning Collaborative are that not only will you be able to try and implement coordinated care plans, but you'll also learn how to understand from the patient what their experience is and incorporate that into the work, and to use some quality improvement tools to actually test some new things and actually measure and see whether you've made any change for the patients and for yourselves as a provider. And so with that, I'm going to say thank you very much and say you're a quarter of the way done on your pre-work for the Learning Collaborative session, and I look forward to meeting you in person on March the 31st. Thank you.